So a brief overview of today's talk. We'll go ahead and start with a quick primer around what digital mental health is, what it looks like, along with an overview of our work at PsyberGuide. Then we'll pass the ball over to Dr. McGrath, who will talk about integrating digital tools in therapy and sort of what that looks like from the perspective of a clinician. And then we'll go into a Q&A/discussion session where folks will be able to ask their questions and get those questions answered around using apps and digital mental health tools in therapy. So our goal here is to look at this from various perspectives. And so from the perspective of clinicians, consumers, researchers, and potentially even app developers. And then from there, we hope we can learn what questions people have about the field and then again, provide answers to those questions. So we definitely encourage you to stick around, especially for the discussion, ask a lot of questions, and then in the interest of time, again, throw those questions in the chat and we'll keep track of it that way. All right, so with that being said, I do want to introduce one of our team members, Martha, and wanted to pass it over to Martha to kind of give an overview of, I'll stop sharing my screen. And then pass it over to Martha to give an overview of digital mental health, as well as, again, some of our work at PsyberGuide.
Yeah, thanks, John. Can I just confirm you can see my slides?
Yep.
Great.
Yep.
Thank you. So yeah, just one, as John said, also hello for those of you I don't know, I'm Martha Neary and I manage One Mind PsyberGuide. So I wanted to just talk a little bit, very brief overview of the space of digital mental health. I guess when we talk about digital mental health, that really could encompass a whole range of technologies, which might include apps, might include websites, wearables, and other other innovations that we're seeing more and more in the space, like virtual reality. For the purposes of today and for the purposes of a lot of what we do at One Mind PsyberGuide, we're really focusing a lot on apps. That's a lot of where the space is. So I'll kind of be focusing mostly on apps, but also want to acknowledge that there are, other technologies that are included in kind of the umbrella term of digital mental health. And I think we'll be seeing more and more of those as well emerging as time goes on. Thinking about mental health apps specifically, so the bottom line is there are thousands and thousands of mental health apps out there, and there's sort of too many to choose from. So their estimates suggest there are over 300,000 apps for health available mostly on the Google Play and iTunes stores for people to download. About 15,000 to 20,000 of those are for mental health. So that's a huge, huge number. Of the apps that are out there for mental health, there's there's quite a range of things available. There are, a small number of those products have been researched directly. So we see maybe about 5% of that number have direct research evidence supporting their use. The majority of the remaining apps don't have direct research evidence. And that's not to say that they won't work, but it's just to say that we don't know for sure. There haven't been trials completed on them, and we don't have kind of, definitive, as much as anything can be definitive, evidence that something could actually be supportive for people. So, they might just be potentially there, if someone's using one of those apps that hasn't necessarily been researched, it could maybe end up being a better use of their time and their resources to direct kind of that energy elsewhere and use an app or a tool that has been researched. We do also see, unfortunately, a small number of apps out there that have quite very sort of incorrect advice for people in managing their mental health. And luckily, this is a small number, but we've seen one of the kind of infamous examples that we've talked about on our team is an app for people with bipolar disorder, and it advised people to take a shot of hard liquor before bed during a manic episode, which is obviously terrible, terrible advice. So there are a small number of things out there that have those kind of very wrong pieces of information. So that's why it can kind of be a little bit difficult to navigate the space. And I'll move on to, you know, some resources in a few minutes that can help you navigate the space. Do you want to talk a little bit about, you know, a question we get a lot is, do these things actually work? And there is certainly building and emerging evidence that these things can be helpful for a range of mental health challenges. There are, you know, a number of recent analyses looking at apps for depressive symptoms and anxiety and stress, and have, you know, they have shown promising results. And a lot of the papers that are coming out in this area really suggest that they're actually particularly useful when they're used as a supplement to standard care. So when they're used on top of traditional treatment is where we're seeing a lot of the effects there. So kind of tying in with, you know, what we're talking about today, which is around really using these things in therapy. So at least at One Mind PsyberGuide, there are a few different use cases that we think of when we think of mental health apps. And we certainly don't suggest, or we don't believe that these things should be used in replacement to seeing a licensed professional. They can be a great first step for help seeking. So, you know, I like to imagine that if someone is maybe feeling unsure about where to get help, maybe feeling a little bit daunted by the possibility of getting help, because it can be quite a daunting task, that maybe downloading an app and using one might be a good first step in their help seeking, to help them see, okay, I can do this, I can use this app, and what are the next steps in my help seeking. They can also be a great thing to just stay on top of overall wellness. So maybe not necessarily if you're having, you know, mental health symptoms of a particular mental health disorder, but something that we all need kind of in our toolkit to stay on top of our overall wellness. I think they're also a great way to kind of leverage a medium that people are already using. And I think about this in particular in relation to youth. You know, youth are on their phones almost constantly throughout the day, and using their phones for a lot of different things. So this is really kind of engaging with a medium that people are already familiar with and people are already kind of comfortable using and excited about using. So just leveraging that to provide some mental health support. And again, another, you know, use case that we think of a lot in relation to mental health apps is as an add-on to treatment already being received. And there's a whole range of different mental health apps out there. I put screenshots, you know, from 4 or 5 products, but there is so much variation in the space in terms of the types of tools that exist. And it really depends on the type of tool, you know, the way you might think about integrating this into treatment. So the first example on this slide here is a mood tracking app called, this one in particular is called Dailyo, and it's a pretty popular app. And we see, you know, people tend to like this aspect of tracking how they're feeling and being able to, most of all, being able to maybe reflect on that over time and help identify kind of triggers and patterns in their mood. And you could imagine if this was being integrated into treatment, maybe this could also be a really helpful way for, you know, when I go see my therapist next week, I can take out my phone and tell my therapist, okay, over the last month, this has been my general trend in mood, as opposed to trying to think back over the last month and see, you know, try to, you know, recall how things have been going. You have the data there in front of you. The second app here, the purple one, is from an app called Sambella. And that app is a CBT app. So that's really, you know, taking something that is already happening in traditional treatment, cognitive behavioral therapy, which is sort of a, you know, gold standard for treating anxiety, and, you know, leveraging a technology medium to help people work towards different goals and achieve different things that are important to them. And then the third is from Headspace, which I'm sure we're all familiar with, is a meditation app. So these 2 apps, really, you could think of those as maybe, you know, there's something that someone's going to use in between sessions to, you know, practice different skills in their they're learning with their therapist, like relaxation skills or CBT. And then the last screenshot here is an app called Youper, which is a AI chatbot. So that's kind of something different again. It's maybe more a little bit replicating, I think, something that happens in therapy, you know, talking through how you're feeling with a therapist. And in this case, the chatbot is really helping you kind of work through that. So just wanted to kind of point these out as, you know, some of the variation that's out there in mental health apps. And I think that how these things will be integrated into treatment really depends on the specific app itself. So at One Mind PsyberGuide, you know, given all I've mentioned so far about how many apps there are and how little evidence there is, obviously it can be really difficult to, you know, make an informed decision and try to choose, you separate kind of the good from the bad. And that's what we're trying to help people with at One Mind PsyberGuide. We have an app guide on our website that has reviews of over 200 products, and folks can go there and search based on certain treatments or conditions that they're interested in. And just as a very quick overview of what we, the ways that we review apps. So we look at the credibility of an app. So that's really looking at kind of the research supporting an app and the credibility of the development team, and really trying to answer the question of how likely is it that this app will work for me. We also look at the user experience of the app. So how fun, engaging, easy to use is the app. And that's kind of getting at, you know, even if this is likely to work, will I actually use it and will I stick with it? Transparency then is looking at how transparent the privacy policies are around what happens to users' data when it's entered into the app. So, you know, what actually happens when I use this app? Where does my data go? And we also have some professional reviews of apps as well, which talk a little, they're a more narrative review, and they talk a little more about, you know, the pros and cons of certain apps and some recommendations for use. One part that isn't captured here, which I think is really important to the conversation around bringing apps into therapy, is this idea of fit. And that's really something that has to be, I think, really evaluated on a very kind of case by case basis, depending on, you know, the individual needs of a client. And when we think about fit, I guess we're thinking of, you know, things around access, first of all. So, you know, what does this client's access to technology look like? Do they have a smartphone? Do they have, and beyond that, do they have consistent access to Wi-Fi? Because that could be a factor there, whether they need to be connected to the internet to use certain apps. Also looking at their level of how comfortable are they with technology. Also, how skeptical are they about technology? You know, how do they feel about using technology in general? Have they used technology before? Have they used apps before? Have they ever used health apps before? And then another component of, which is more around kind of the culture of the app, you know, could your individual client see themselves in the app, in the images that are used, in the language that's used? Is it going to resonate with them? So these are things that really, I think, need to be, you know, evaluated on a very individual basis. I included this this figure here from a paper that we published last year, I think, which really kind of, and maybe we could, you know, include this as a follow-up in the email, but it's really kind of moving from the process of narrowing, so kind of defining, you know, what is the concern of your client, and what are really the goals that you're trying to achieve by bringing an app into the therapy process. Then exploring the app, so kind of, you know, One Mind PsyberGuide could be one resource to help you explore the different apps that are out there and kind of start to think about what are the different apps that might be contenders here. And then contextualizing. So again, that's really moving from the process of looking at the credibility or transparency scores to really contextualizing the app within your client situation and evaluating the fit there. And then, you know, it's kind of a cyclical process, always kind of getting feedback from the client and reevaluating and seeing how that's going over time, and doing that kind of collaboratively, I think, with a client to ensure that you know, the app that they're using is actually something that's working for them. And then a couple, I know Dr. McGrath's going to talk more about, you know, using these things in therapy. I did want to provide just a couple more resources that I think are really, really helpful when thinking about this. And one document that I go back to time and time again is actually from the DoD, and it's their Mobile Health Practice Guide. And this is a really comprehensive guide for integrating apps into treatment. And it talks about it from, moving through these kind of 5 key steps of mobile health clinical integration, right from, considering how this is going to disrupt your workflow, talking about things like how to introduce the app to the client. And it gives some really nice concrete examples of, questions to ask a client and certain things to really be aware of when you're introducing an app. And then moving through, right down to kind of documentation, how to actually document the use of the app in therapy. So that's one resource that I think is really comprehensive, and maybe we can include that in the follow-up email. Also, I will give a plug for our blog on PsyberGuide, and I think there's a couple of pieces there which are actually looking a little bit blurry here on this slide, but a few pieces that I think are really helpful that talk about mental health apps specifically from the perspective of the therapist and how you might integrate these into practice. The first one actually is one that I again, something I go back to time and time again, and really gives a nice overview of, again, those kind of conversations to have at the beginning of the process. What might you want to talk to your client about, what questions to ask your client in order to kind of determine their level of interest in using a mental health app. And then the second one, you might recognize our wonderful guest blogger there for the second piece, which is Therapy in a Digital Age, another really great piece. And then the third one, looking specifically at virtual group treatment. And then, so all of those resources have really talked about, what a therapist or a provider might want to, more resources for a provider when thinking about bringing apps into therapy. I'm conscious that not everyone, we're not all providers here, and there's a variation of folks who are involved in this conversation. And I think that, I was also trying to think of this from, from my perspective as a client, or what I would want to, what would be some resources helpful if I was interested in kind of initiating a conversation with my own therapist about bringing an app into therapy. And I think really just doing that, I think starting the conversation with a therapist can be very helpful. And, if there are apps you have in mind, why not chat to your therapist about it, see what their thoughts are on using an app. They can also might have recommendations themselves for specific apps you might want to bring into the treatment process, and talk about, really working together to try to figure out ways that using apps in therapy can work for both of you.